As in early loading of restored implants, multiple factors come into play. Not surprisingly, common sense should prevail. If the device is in good quality bone, is not loaded with chewing forces, and is stable at the time of placement, immediate loading with orthodontic forces is not a concern. OrthoAnchors are designed for immediate loading. Due to the path of placement, load should be at roughly 90 degrees to the long axis of the anchor. The force needed to move a canine to canine segment of teeth is well below the load limit of the anchor. If there is a concern regarding stability at the time of placement, loading can be deferred or a segmental approach can be used in tooth movement. Indirect anchorage, that is, using the device to reinforce anchorage on existing teeth, lessens the load applied to the anchor and is another alternative in a questionable situation. The bottom line is, implantable anchorage works, and it works to allow tooth movement, which has been traditionally considered difficult, if not impossible. The system is affordable and simple in design, making anchors easy to place, use, and remove. A variety of sizes allow the clinician to choose a length that is appropriate for almost any situation. Components are packaged in an autoclavable kit for ease of use. In patients having inadequate alveolar bone for anchor placement, another alternative is available. Specially designed bone plates secured by mini screws can be placed in the palate or higher up on the lateral aspect of the maxilla. Once in position, they can be used much like the OrthoAnchor to assist with the retraction of anterior teeth in a Class II patient with increased overjet. Although an incision is needed for placement and removal, the exposure is relatively minor and well tolerated by patients. The tubular portion of the C-tube plate passes permucosally and can be used to stabilize the distal end of the orthodontic arch wire. The anterior teeth are retracted as a group using hooks soldered to the anterior portion of the arch wire. With no forward drift of posterior teeth, a Class I occlusion is easily achieved. For patients having lingual orthodontic treatment, the C-palatal plate can be used for direct anchorage in retraction of the incisors and canines. The components include center drive screws and bending pliers which allow close adaptation of the plate to the underlying bone. The indications for the C-tube plates are similar to any form of implantable anchorage. Ease of placement and immediate loading make these devices a viable treatment alternative.